Welcome to Pepper's Nursing Corner, your go-to place for NCLEX-PN practice questions and nursing tips. Let's make studying simple and stress-free. The nurse is interpreting the following ABG results: pH 7.53, PaCO2 27, HCO3 23. Which of the following is occurring? Respiratory alkalosis, respiratory acidosis, metabolic alkalosis, or metabolic acidosis? The correct answer is respiratory alkalosis. Normal ranges are as follows: pH 7.35 to 7.45, PaCO2 is 35 to 45, and HCO3 is 22 to 26. This client's pH shows alkalosis. Their PaCO2 is alkalytic, and their HCO3 is within the normal range. This client is in respiratory alkalosis. The nurse is caring for a client with COPD exasperation who is on 2 liters of oxygen via nasal cannula. The most recent ABG result is PaO2 of 85% and PaCO2 of 52. What is the appropriate nursing action? Administer a nebulizer treatment, increase the oxygen to 4, titrate the oxygen to 1, or continue to monitor. The correct answer is continue to monitor. PaO2 is a measure of the partial pressure of oxygen in the blood. A normal range is between 80 to 100%. This client has the appropriate amount of oxygen, and the nurse simply needs to continue monitoring for any changes. The nurse is reviewing ABG results on a client and understands the term partial pressure to mean which of the following: the concentration of gas dissolved in blood plasma, the arterial blood pressure, the proportion of the 4 main blood components circulating in the arterial system, or the amount of pressure added to the client's blood pressure by basis in the blood. The correct answer is the concentration of gas dissolved in blood plasma. Many components of blood can be measured by physical measurement, such as red blood cells, white blood cells, and platelets. However, blood gases are different. When a gas dissolves, it must be measured by its pressure rather than its physical measurement. The measurement is noted as a partial pressure. A client presents to the emergency department in respiratory distress. The nurse obtains a set of vital signs, starts a 20-gauge IV in the right antecubital, and places the client on 3L of oxygen. After reporting the results to the provider orders a lab draw and a set of ABGs. The nurse correctly understands which of the following to be appropriate reasoning for ABGs. Arterial blood will reflect a partial pressure of gas, but venous blood will not. Arterial blood draws carry less complications than venous blood draws. Arterial blood provides more accurate systemic results for blood gas than venous blood. Arterial blood gives more accurate results for acid base, but not blood gas. The correct answer is arterial blood provides more accurate systemic results for blood gas than venous blood. The blood in the arteries is fully oxygenated, while the blood in the veins is deoxygenated. This gives a better clinical picture of how the body is behaving on a systemic level, both with blood gas results and acid-base balance. For this client, the provider needs to see the PaO2, PaCO2, and SaO2, as well as whether the client is in respiratory acidosis and how serious the respiratory acidosis may be, as well as whether the body is compensating. A client's ABG results are returned and the nurse notes a base excess of 1. The nurse accurately concludes which of the following: the client has a base deficit, likely caused by a metabolic process such as diarrhea. The client's fluid resuscitation is contributing to the high base excess, and the provider should be notified to adjust the fluid rate. The client has a slight base excess, and the body will likely begin to compensate with a lowered respiratory rate. Or more information is needed on this client's clinical picture even though the value was within normal limits. The correct answer is more information is needed on this client's clinical picture, even though the value is within normal limits. Base excess indicates the amount of base in the blood. It should never be viewed independently of other ABG values. The base excess may be solidly within normal limits, but this does not mean that the client's acid-base balance is normal, nor does it indicate that the client is clinically stable. The nurse is caring for a client in DKA. The nurse notes that the client's ABG result reflects a low pH, a low HCO3, and a low PCO2. What is occurring with this client? Partially compensated metabolic acidosis, fully compensated metabolic acidosis, partially compensated respiratory alkalosis, or fully compensated respiratory alkalosis. The correct answer is partially compensated metabolic acidosis. DKA leads to metabolic acidosis. The client's pH and HCO3 reflect metabolic acidosis. Since the PCO2 is low, the client is partially compensating for the metabolic acidosis. The nurse is working in the emergency department caring for a client who presents with slow, shallow respirations related to a suspected narcotic overdose. The provider orders blood work, including ABGs. Which of the following acid-base imbalances would the nurse expect for this client? Metabolic alkalosis, respiratory acidosis, metabolic acidosis, or respiratory alkalosis? The correct answer is respiratory acidosis. The client's ABGs would most likely show a pH of less than 7.35, which is acidic. The PaCO2 would most likely be greater than 45, which is the cause of the low pH level. Since this client is hyperventilating, he or she is not able to blow off CO2 fast enough. A nurse is caring for a client who requires a mechanical ventilator for breathing assistance. The nurse checks the client's routine ABG values and notes pH is 7.51, PCO2 is 32, HCO3 is 24. These laboratory values best represent which of the following? Respiratory alkalosis, respiratory acidosis, metabolic acidosis, or metabolic alkalosis? The correct answer is respiratory alkalosis. The client's ABG results in the example represent respiratory alkalosis. A normal pH is 7.35 to 7.45. Normal PCO2 is 35 to 45, and a normal HCO3 is 22 to 26. In this case, the blood has a pH level that is higher than normal, which means that the blood is alkaline instead of acidic. The carbon dioxide level, which is the PCO2, is low, and the bicarbonate level is within normal limits, indicating that the problem is uncompensated respiratory alkalosis. A 12-year-old boy arrives at the ED complaining of difficulty breathing. His parents inform the nurse that the family has a long history of asthma and that the child has suffered previous wheezing episodes, but none this severe. ABG studies were performed. While the patient is breathing room air, 21% oxygen, it reveals pH 7.21, PO2 65, PCO2 62, and HCO3 is 24. The nurse knows that if therapy is not implemented immediately, this patient could suffer respiratory arrest, gastric aspiration, adult respiratory distress syndrome, or acute renal failure. The correct answer is respiratory arrest. If this patient is not treated, respiratory arrest will occur as a result of airway obstruction, acidosis, and hypoxemia. Hey, we're all done for this episode. Keep studying and you've got this. If you found this helpful, please make sure to hit the like, subscribe, and hit the notification bell so you never miss a new practice video. Thanks.